Hey there, good evening. Nice to see you. Welcome to the Bronx Buzz. This is BronxNet's program where we talk to reporters and writers and editors and people who are putting stuff out in the Bronx. In our second segment, we're going to talk to a Bronxite who is just nominated for a Grammy, which will be interesting and exciting. But in our first segment, we're going to say hello to Caroline Lewis, who is a healthcare reporter or the healthcare reporter at WNYC in Gothamist. Nice to have you with us, Caroline.
Absolutely. Thanks for having me.
Just a little background about you, if you wouldn't mind. How did you find your way to WNYC?
Yeah, so I'm from New York originally, and I went to the CUNY Graduate School of Journalism, and then I actually interned at the time at WNYC's Health Desk. And after graduating, I covered healthcare for Crain's New York business. And when I left there, I freelanced for Gothamist and sort of found my way into the newsroom permanently a few years ago, covering COVID, and I've covered, everything since. So.
Has healthcare always been a desire of yours, like something you want to do? Or did you just kind of step into it and say, well, this is as good as any and, I can handle it?
It was an accident, I would say, but
I
a
knew that
happy
was the case.
accident.
Yeah.
Yeah, I've always wanted to be a journalist, and I was always interested in, issues around like, you know, uh, sort of racial justice, disparities in access, criminal justice reform, things like that. And interestingly, in healthcare, there are a lot of issues around disparities in healthcare access. There's a lot of issues around how we treat certain issues like mental health, drug use, things like that. Is it a criminal justice issue or a healthcare issue? So there's really a lot you can do in healthcare.
It's really interesting that you presented it that way because the article that I thought was particularly interesting was the one entitled Overdose Prevention Centers Did Not Increase Crime in New York City Neighborhoods, as study finds. Now, I mentioned it before the show. I'm going to give you a little background. In my community, there was a proposal of an empty storefront that they were going to make it a treatment center of some sort, maybe a needle exchange program, etc. But the community was like, oh, it's going to bring drug addicts in, it's going to bring drug dealers in, and it's going to change the nature of our neighborhood because it was in kind of a very busy area. What you are now telling us and what the piece that you did for WNYC and Gothamist showed that the numbers don't support that fear. Why don't you explain a little bit what you found?
Yeah. So what was interesting about this study was it looked at sort of crime and quality of life issues around the two overdose prevention centers in Manhattan. And those are spaces where people can use illicit drugs like fentanyl under staff supervision so that if someone overdoses, someone can intervene. And there's already been a lot of, data reported showing that they've intervened in over 1,000 overdoses since these centers opened in late 2021. But there wasn't as much, sort of research looking at what the impact was on the surrounding areas. And like you said, there was a lot of concern that these centers would bring more public drug use, even though their stated mission is to give people a place, a private place to do drugs, and so that they aren't doing it on the street. People were concerned about more public drug use, more crime, things like that.
Mm-hmm.
And the study looked at drug statistics around crime in the area, in the areas around these two centers between early 2019 and late 2022, so about a year before and after they opened. And each center was based in what was already a syringe exchange program. So they were already serving drug users before the overdose prevention centers were added. And so the study authors looked at the change in sort of like crime statistics during that time, but then also compared it to other sites around the city where there are syringe exchange programs to look at whether adding an overdose prevention center, which is really just sort of like a small change, actually made a difference. And so
I mean, I can just call out numbers. Felonies increased by similar amounts near the overdose prevention centers and comparison sites. So, in other words, there was no spike in crime after they had put this center in or these centers in different locations. In other words, it wasn't one place. They did a survey. And by the way, we should credit the Journal of the American Medical Association for that. That study. I, you know, I wonder if a study like this and your wonderful reporting for Gothamist would reach communities who are concerned about these things and realize that maybe we're looking at solutions here rather than creating problems. I understand the fear. I mean, nobody wants to, frankly, be hanging around with drug addicts who might behave improperly. But in these centers don't seem to be creating a bigger problem than you might otherwise have in the neighborhood.
Yeah, I mean, that's definitely what the study authors concluded, but and they looked at 911 calls, 311 calls, summonses, and crime reports filed by both the public and police. And so they were sort of trying to, use a range of data. But of course, it's not perfect. And one thing they did find is that arrests for drug use and weapons like actually decreased dramatically around the overdose prevention
That would
centers.
shock a lot of people.
Yeah, and I mean, for people sort of in the know about how they came to be, I don't think it's super shocking because, former Mayor de Blasio had to sort of create an agreement with the police that you're not going to, crack down on people coming into these centers or else nobody's going to use them. And so I think that's sort of the understanding of what
Yeah, that's
happened.
pretty logical, frankly. I'm
Yeah, I
sorry
mean,
for
especially
laughing,
for
but it is pretty logical. Yeah.
yeah, especially for drug possession. If you're going to get people for drug possession when they're going somewhere explicitly to use drugs, it doesn't really work. But I think like the question is whether some people will look at that and think it invalidates all of the data, even though, there are plenty of other
Right.
sort of data sources they looked at showing that, for instance, 911 calls about medical and emergencies and crime also went down around the
And
OPCs.
and the number that you had in your article was 30%. That's a
Yeah, exactly.
significant number. You
Yeah.
know, we
And
we we
yeah.
did a show. This goes back, geez, got to be 1994, when my TV show Bronx Talk first started. We did a show on needle exchanges, which was at that point, HIV. I mean, there was a lot going on, but it was a relatively unique and innovative concept, and we did a show about it. It just made sense to me, although I understand personally the fear in neighborhoods saying, well, wait a minute, we don't want more drug addicts around here. But if the data shows that it doesn't increase crime and maybe helps some people make contact, et cetera, maybe we got half a chance to do a little better, you know?
Yeah, and I did speak with one of the study authors who was actually a former police officer in New York, and he's worked both in police departments elsewhere and also as a researcher. And there was another study in the works on sort of like the impact of these overdose prevention centers in the area, but the results weren't due out until 2027. And he basically said, like, we can't wait that long. Like the conversations about whether to open these spaces, whether to fund them, that's all happening right now.
Yeah.
And so we need to look at what data we have that can sort of speak to this, debate that's going on.
Well, year after year, the South Bronx leads New York City in drug overdose deaths. That is quoted out of your article. So now let's get to the reality of St. Anne's Corner of Harm Reduction in Longwood. Is working to open the first overdose prevention center in the Bronx, but they're running into this same dialogue. Now, I can understand in that neighborhood or any neighborhood that people would say, "Hey, we don't want, what are we doing?" On the other hand, maybe it's a way of addressing a problem that we haven't figured out yet. I mean,
Yeah. So St. Anne's, what's interesting is St. Anne's has been in its current location for a long time, again,
yes,
with a needle exchange program. And of course, they have a lot of other services there. But basically, they're already serving drug users in the neighborhood. But there are people, on the local community board and local, elected officials who believe that even though that's the case, opening an overdose prevention center would just attract a lot more people to the area, potentially result in more public drug use. And that's something they don't want. And so they were pushing St. Anne's to relocate and open their program near the hub instead, which is like a highly trafficked commercial area and an area people say has a lot of drug use out in the
I
open.
used to have an office down there, and I can vouch for that. I mean, I
Mm.
saw people on the street, overdosing, and it was very sad.
Yeah. And I mean, the thing is, speaking to Joyce Rivera, who runs St. Anne's, like she
Mhm.
even agrees with them, like, oh, that would be a great location for one of these centers. But it's expensive to relocate. And she, wants to buy a space so that they're not forced to move soon.
Right.
She found a space last time I checked in with her over the summer, they found a space that cost like $11 million or something like that. And one of the big issues facing overdose prevention centers right now is that even though they have, support from the mayor's office, they don't actually have funding because basically the city and the state both are afraid to put any money towards these centers because they, are still technically federally illegal.
Well, that might be the case. On the political side, they may not want to do that because of the a public outcry. In other words, elected official says, "Oh, I'm going to do this in your neighborhood," and they're going to say, "Well, we don't want you to be our representative anymore." Before we run out of time, just a couple of minutes. You also wrote about how City Meals on Wheels and other senior services are prepping for the next disaster, next New York City disaster. I think that's interesting because we're all concerned about who knows what we will do. Just a couple of words, if you would, about how they are, in fact, preparing for all the possibilities that likely will happen.
Yeah, it's interesting. So, City Meals on Wheels actually is a nonprofit that provides sort of supplementary meals to what the other Meals on Wheels programs do. So, like Meals on Wheels programs around the city deliver food to homebound seniors, and City Meals on Wheels sort of helps support them. It provides meals on weekends, holidays, and in emergencies when they can't get to people. And so, one of the things they do is prepare these emergency food kits for seniors. And, they were saying they used to go out just in the fall, ahead of the winter months in case there's a snowstorm or something else that disrupts deliveries. And now they're saying we need to give these out, more frequently throughout the year. We need to do more to ensure that people always have food because you never really know what kind of emergency you're preparing for.
Do
Um,
do we know do we know what actually they're doing? I realize that they're
yeah.
getting their heads together about it. Do we have a result to that conference?
Right. Well, I mean, it's a small change, but one thing they're doing is sort of just giving out these boxes more frequently throughout the year. But then even like, speaking to JASA, another senior service provider, they were saying like since COVID, they've realized like their Meals on Wheels program has this window, this like connection to people who are otherwise
Right.
isolated and vulnerable. And so they can sort of interview them about what they need in an
What they need.
emergency,
Listen,
things
we
like
Caroline
that.
Lewis from WNYC and Gothamist, we got to run. Thank you so much for all your reporting. Needless to say, in the Boogie Down Bronx, healthcare is, well, we're down here, but it's
Yeah.
really that much of a priority for all of us. And what you do at WNYC and Gothamist is so important to us. Thank you so much.
Thanks. Thanks for having me.
Okay, we're going to take a short break. And when we come back, as I mentioned at the top, it's Grammy nominee Bobby Sanabria will be with us. Don't go away.